Hi, I'm Floyd Labati, and today we're going to look at ways to effectively improve your ankle dorsiflexion. So the question is, what is ankle dorsiflexion and why is ankle dorsiflexion important? Very simply put, ankle dorsiflexion is the ability of your shin bone to move towards your foot bone or the other way around. So the less of an angle you have here, the more ankle dorsiflexion you have. This is particularly important for things such as squatting and changing direction, because if you lose ankle dorsiflexion, what ends up happening is you become at risk for certain types of injuries, and sometimes you have a reduction in performance. Okay, so a very simple test that you can perform at home or in the practice to check ankle dorsiflexion is the knee to wall test. This can be performed either standing or kneeling. What you do is you keep your body square, you make sure that your foot is flat, meaning your big toe is down and your heel is down. Then you get your knee to touch the wall. If your knee lifts, that means your ankle range is limited and you have to go closer to the wall. In this case, you'll see my foot stays flat, my knee can touch the wall. That means I can go slightly further back. The further back I go, the more ankle dorsiflexion I need to keep that range of motion and keep your heel down. So you then measure the distance from the wall to the toe. The great way to use this assessment is to compare right versus left, and then also compare it based on your previous tests and also what's normative for your body and for your sport. There are many ways that you can improve ankle dorsiflexion. However, we're going to go through 3 categories of exercise that tend to give the best bang for buck to improve your ankle dorsiflexion. The first category of exercise is very simple. It's the passive stretch. The first stretch we're going to do is for, in this case, the left leg. We're going to use either a box, we can use a wall to support, and then we're going to bend the front knee and straighten the back knee. This puts a stretch on the gastrocnemius lateral head and medial head. Those are the superficial muscles. Now, these muscles are often the cause of stiffness for ankle dorsiflexion. By doing this, we tend to give them a very nice stretch and improve their range of motion. The second stretch we can do is a soleus stretch, which is a muscle that's slightly deeper. To do this, we keep the knee in the same position up front, but then bring the back leg slightly closer and bend the back knee. That will often give you a slightly deeper and lower stretch. Now, these stretches, according to the literature, can be done for varying amounts of time. We generally give stretches 15 to 45 seconds and 1 to 3 sets. It all depends on the amount of stiffness and the goal of the patient. So, our next exercise is a calf raise with an eccentric bias. What does that mean? The eccentric component of your exercise is actually your negative component. So, in a normal calf raise, the calf raise looks like this. It'll be about 1 second to go up, 1 second hold, and about 1 second to go down. An eccentric component is the way down. To improve our eccentric bias, what we would then do is go something like this, and we can vary and play around with the tempos. We can go 1 second up, 1 second hold, and 1, 2, 3 seconds down. We can increase that eccentric component to 5, 6, 7 seconds, and with us, what we tend to do with the eccentric components of the exercise, we'll go 3 to 5 sets and 5 to 10 reps, depending on where the patient is and what our goals are. The next exercise we're going to do is foam rolling of the calf. Now, a few years ago, we spent way too much time foam rolling everything. Now, in the right patient with the right indications, i.e., a patient with a stiff calf and with limited ankle dorsiflexion, we often find that foam rolling the calf improves the range of motion very significantly. One caveat is that for most of our patients, we don't foam roll the Achilles because it's too tender and makes you feel way worse. Now, how do you foam roll your calf? Very simple. You go with the affected leg on the foam roller. What you'll do is, if you want to hit the inner part of your calf, which is on that side, you will then turn the toe inwards. If you want to hit the outer part of the calf, you'll turn your foot outward. Very simple now is you'll take your opposite leg, apply a light pressure onto that calf, and you can just oscillate, small little oscillations onto the calf on the inside and onto the calf on the outside. Now that's very mild. if you want to increase the intensity of the foam rolling, you will then turn your toe in and lift up your hips, and you'll foam roll in there, and you turn your toes out, and you can foam roll on the outer part. Now, the sets and reps will vary according to the stiffness of the patient, but very often we'll give either 10 to 15 reps and 1 to 3 sets to improve that ankle dorsiflexion. Guys, I hope you enjoyed our video on ankle dorsiflexion. If you liked the video, hit the like button and smash the subscribe button. If you have any comments, leave comments and questions in the comment section below, and we'll catch you soon.